Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Dr. Fauci, let me start with you. The surge of COVID-19 that is devastating India is a painful reminder, really, that we can't end the pandemic here until we end it everywhere. And I'm glad the Biden administration is leading that global fight, the World Health Organization, and funding global vaccine efforts, and committing to donate 60 million AstraZeneca vaccines to other countries by July 4th. India's outbreak really underscores the need for a robust public health infrastructure in the U.S. to respond appropriately to this pandemic and future outbreaks as well. I wanted to ask you today, Dr. Fauci, what can we learn from India's outbreak that we should apply to our response here in the U.S.?
Well, I think one of the important things is don't ever underestimate the situation. You know, the reason that India is in such dire straits now is that they had an original surge and made the incorrect assumption that they were finished with it. And what happened, they opened up prematurely and wind up having a surge right now that we're all very well aware of is extremely devastating. That's the first thing. The second thing is preparedness with regard to public health preparedness, which we, as a lesson learned for future pandemics, have to realize that we need to continue to build up our local public health infrastructure, which over the last decades we have let to actually, in many respects, go into disarray, likely because of our successes in controlling so many diseases. The other lesson that's learned, Madam Chair, is that this is a global pandemic that requires a global response, and we need to pay attention to the responsibility that we have, not only for our own country, but to join with other countries to make sure that we have the access to interventions, particularly vaccines, throughout the world. Because if it continues to have dynamics of virus anywhere in the world, we have a threat here in the United States, particularly with variants. And you know, there's one variant in India that is also a new variant, number 617, B617. So those are just a few of the lessons that I believe we can take from what's going on in India. Thank you.
Thank you.
Ranking Member Burr, members of the committee, thank you for giving me the opportunity to discuss with you this morning the role of the National Institute of Allergy and Infectious Diseases and the NIH in research addressing the COVID-19 pandemic. As I had mentioned to this committee during a last hearing that we attended, we have a strategic plan that has four major components: fundamental knowledge of the virus, diagnostics, therapeutics, and the development of safe and effective vaccines. For the purpose of today's discussion, I will focus on the issue of vaccines. We often get asked how it could be possible that the virus was discovered in January of 2020, and we had doses of vaccine going into the arms of individuals, a vaccine that was highly efficacious and safe 11 months later in December of 2020. Well, the story behind that has been the decades of investment in basic and clinical biomedical research that has led to our ability to accomplish this extraordinary feat. Just some examples: the basic preclinical and clinical research in developing vaccine platform technology, particularly the highly successful mRNA platform. In addition, scientists at the Vaccine Research Center at NIAID, as well as grantees and contractors throughout the country, developed the optimal immunogen, which is the conformationally correct spike protein, which is used by virtually all the vaccines that are being tested right now. And finally, the utilization of a clinical trial network that we had set up decades ago for influenza and for HIV. When one thinks of efficacy, it really is what are the results of a clinical trial. Often, when you get into the real world, the effectiveness of vaccines falls short of the original efficacy. That is not at all the case with the vaccines for COVID-19, because the real world effectiveness is even more impressive than the results of the clinical trial. One example, the University of Texas looked at 23,000 of their employees and found that the incidence of infection was 0.05%, markedly lower than unvaccinated individuals. The CDC has multiple MMWRs reporting on various aspects of the real-world effectiveness. Importantly, a recent paper in The Lancet reported on the experience in Israel, which, as Senator Burr had mentioned, has done an extraordinary job of getting their citizens vaccinated. And what we have seen is a remarkable diminution in the number of infections that reached a critical turning point when they reached a certain percentage of the individuals who were vaccinated. It wasn't only limited to Israel. Another recent paper in the country of Qatar showed a similar type of a result, in which not only was the mRNA vaccine highly effective in over 300,000 individuals tested in preventing the original wild-type virus, but it also had a very interesting capability of protecting against mild to moderate disease of a problematic variant from South Africa, the 351, and protected virtually 100% from severe disease, including hospitalization and death. And so when the president makes the goal of 70% of adults receiving at least one vaccine by the 4th of July, we believe that that is an attainable goal. The reason we feel it's important is that I believe that we are about at that critical turning point when we get a certain percentage. We don't know exactly what it is, but clearly the majority of individuals in the country vaccinated, we will see a sharp turning point and a marked diminution in cases. And so, as I said the last time I testified before you, we are in a race between the vaccine and the virus. If left to its own devices, will continue to surge. Based on experience thus far in this country and globally, I feel confident that if we continue to vaccinate people at the rate that we're doing, that we will very soon have a situation where we will have so few infections in this country, we will begin to return to the normality that all of us desire so much. Thank you very much.
Thank you.